When I was just fresh out of college, I ended up going on a medical mission trip to Guatemala. I was serving as a translator for the docs working there. There was a little kiddo about 5 years old. His name was Marvinito. He had a younger brother who unfortunately passed away because he didn't have access to medical care, and that's when I made that decision that I wanted to be that bridge to care.
I think that the strengths of our program here in Ashland are the general enthusiasm. So it's not only the enthusiasm that is seen in our emergency department, but also in the providers, the nurses, our support staff, administration, even the community, to be welcoming medical learners and new physicians into the community. Outside of that, I also feel as if we've created a strong curriculum where we incorporate a number of different modalities for learning so that we can actually address the needs of different types of learners. We really like that as a newer and a smaller program, we have a unique opportunity to actually make small changes and tailor our curriculum to the interests and either strengths or weaknesses of each year's particular fellows.
Tamarack Health has a strong background in growing our own and creating solutions independently. And so what prompted us to start the program was identifying an opportunity to both meet the organization's needs of continuing to attract and retain top talent in the emergency room, but then also imparting some of our culture and some of our talent on the rest of the state. If we can train physicians that end up in rural communities across the state of Wisconsin and they have ties to the Tamarack GME programs, that is one of the main goals and intents of the program.
The Ashland area is a small rural community, population about 8,000. Ashland is located on Chequamegon Bay, which is part of Lake Superior. Ashland has many hiking trails, biking trails, ski trails. If you like the outdoors, the Ashland area is a great place to live and raise a family.
I have a passion for working in a rural setting, especially in the ER, because I feel like being able to see the community members where I live and work out and about and see how well they're doing after I've treated them is extremely rewarding to me.
What makes Ashland Medical Center a good place for an emergency medicine fellowship? Number one is the area. We have endless opportunities to get outside and explore some of the best natural resources in Wisconsin. From a medical community, we're one of the most rural, one of the most geographically isolated areas in the state of Wisconsin. And so the types of cases, the types of acuity that you see is pretty different than some other rural facilities around the state, which I think lends itself to really, really nice training opportunities for physicians.
I really like working rural because I have the opportunity to do some procedures that I don't feel like I would be able to do in an urban setting. In my experience with more academic hospitals and med school, the ER tended to shift responsibility or delegate tasks to other specialties, so I didn't get to do as much. So for example, I've gotten to do a bunch of joint reductions. I've actually placed an umbilical vein catheter in an infant, which is a pretty rare procedure to be able to do, and I'm very proud to be able to say I was able to do that in my fellowship.
Our providers come from various backgrounds, anywhere from having a traditional emergency medicine residency to being a family medicine, internal medicine, or even pediatric provider prior to going into the emergency department. We also have a wide variety of providers in different experience levels. So we have people who are very seasoned providers, as well as those who are only a couple years out from residency. And this is really great because it allows our fellows to learn from different perspectives, and it helps them to actually create their own practice style throughout the year.
I would recommend this fellowship to anybody who's interested in living and working rural. You get to do a lot of procedures. You get to work with great people. It is an awesome hospital to work in. You get good patient volumes, and you get good experiences. And again, the community is a wonderful place to live and work. I think rural medicine is a hugely important and I think sometimes undervalued part of the medical community. The people here are deeply appreciative. Sometimes folks here don't have the ability to access care due to a lack of resources, so I think expanding that access by having more doctors available is hugely important.